An expert is someone who knows what they know. They have an idea of what they don't know.
My name is Julia, and I'm a final year PhD student at the University of Southampton looking at new immunotherapies to treat neuroblastoma.
My name is Manav Patania, and I lead a research team within the Milner Therapeutics Institute at the University of Cambridge.
My name is Dr. Debbie Hicks, and I work at the Wolfson Childhood Cancer Research Centre at Newcastle University.
My name's Emma Chanak. I work at Royal Manchester Children's Hospital as a lead oncology research nurse.
The research that we do at the lab looks at whether a type of immunotherapy that is already being used to treat adult cancers could also be applied to treat neuroblastoma, with the aim of finding more effective and less toxic therapies for these children.
The focus of our work is the most lethal type of children's brain tumor, often called diffuse midline gliomas. The known standard treatments that we have for other types of brain tumors don't really work when it comes to this particular type. Our research is looking at improving our understanding of how these tumors form in the first place by attempting to replicate what goes wrong in a small fraction of cells at the genetic level in a number of different ways. We hope to then use this information to develop precision, targeted treatments.
Survival rates in children's and young people's cancers has fortunately been increasing, decade upon decade. Part of what's driven this increase in survival rate has been the ever more intensified treatment regimens that we've been delivering to these children and young people. Of course, these treatments are often highly toxic and really do impinge on the quality of survival that the survivors of children and young people's cancer face in later life. And the purpose of my research is to understand what governs these late effects. How can we improve the quality of survivorship after survival from children's and young people's cancers?
My hope is that the research that we carry out in the lab will provide valuable information about the potential application of immunotherapy in childhood cancers, and will hopefully help to design new clinical trials to look at the combination of immunotherapy with conventional therapies such as chemotherapy.
My hope is that the research we are carrying out today will help us understand more about DMGs and lead to better, kinder, more effective treatments for some of our youngest cancer patients.
I'm passionate about reducing the late effects burden faced by survivors of children's and young people's cancer. And what we really want for these survivors is that they move into their adulthood leading long, happy and healthy lives.
I'm really grateful that we're running trials like these at the Children's Hospital that are sponsored by Cancer Research UK, because it gives the family hope when their current standard therapy is no longer working for them. It gives them alternative options and hopefully a longer, happier life.